2, 1.
Bore da pawb, welcome everybody to this meeting, rather shorter meeting than usual, of Powys Teaching Health Board. It's a beautiful morning and we look forward to seeing you at our AGM later in the day at 1:30. So apologies for absence this morning. First, Francis Gerard, Rebecca Collier and Stuart, our Director of Public Health, have sent apologies. I'd like to introduce everybody. It's easier to do it that way when we're working virtually. I'd like to, first of all, welcome representatives from the Community Health Council and any observers who are present today. I'll introduce myself first. I'm Vivian Harpwood, Chair of Powys Teaching Health Board. Also present today are Melanie Davis, Vice Chair of the Health Board, independent members Ian Phillips, Mark Taylor, Susan Newport, Trish Buchan, Tony Thomas and Matthew Dorrance. And present also is the Chief Executive, of course, and the following Executive Directors: Jamie Marchant, who is Deputy Chief Executive and Director of Primary Community Care and Mental Health; Hayley Thomas, who will be starring today, she has a lot of presentations, who is Director of Planning and Performance; Alison Davis, Director of Nursing; Claire Madsden, Director of Therapies and Health Sciences; and Pete Hopgood, Director of Finance; Paul Buss, Medical Director, and of course our Board Secretary, Rani Mellison; Katie Blackburn, who is the Chief Officer of the Community Health Council, and colleagues from the Corporate Governance team who will be supporting the meeting. Please note that participants may look away from the screen from time to time when presenting to enable them to access documents. Moving now to the agenda, which is published on the website along with the papers. Are there any declarations of interest today, please? No? Thank you. So could we turn then to the minutes of the last meeting on the 30th of September 2020? And just as far as matters of accuracy are concerned, did anybody identify anything that was inaccurate or inaccurately recorded at that meeting? If we go through them quickly, it was page 1, 2, page 3, page 4, page 5, page 6, 7, and there are 22 pages, I warn you, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. So can I sign those, please, as an accurate record of proceedings at the last meeting? Thank you. Then for matters arising, are there any matters arising? If anybody does have any, could you please indicate on page 2 or 3, 4 or 5, 6 or 7, 8 or 9, 10 or 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21 or 22? No? Carol, I did think there was perhaps some matter you wanted to raise.
That's correct. Thanks very much, Chair. I just wanted to provide the board with an update in relation to the South Powys Pathways programme work. Members will recall from the last meeting of the board the huge amount of work that is going on around the changes to the patient flows for urgent and emergency care around the heads of the valleys. The changes have been instigated as a result of bringing forward the opening of the Grange University Hospital as part of Narren Bevan's COVID winter planning. We've been working very closely with Narren Bevan, with the Welsh Ambulance Services Trust and with Cwm Taf Morgannwg on making those changes. I just wanted to update that huge amount of work on just being absolutely sure about the flows. So for the vast majority of people for urgent and emergency care, the flows will change from Neville Hall Hospital, and the closest hospital therefore for South Powys is for most of South Powys is the Prince Charles Hospital. Huge amount of work, as I say, on the securing the flows. And now we're very actively in the process of the engagement and communication element of the plan. And I'm really grateful for members of the Community Health Council in particular, and the very close working and support that they have offered us in relation to engagement and communication, as well as the town and community councils who we did a session with earlier in the week, as well as third sector organisations and our primary care colleagues. So just to say that the communication and engagement plan is going well at this stage. The household drop for information is well underway now, with the content signed off. The next few weeks will be really focused on that engagement and communication and ensuring a good level of assessment in terms of readiness. But I note that our next meeting of the board is not until just after the opening of the Grange University Hospital. And so at this stage, I can give confidence to the board that all the steps that we need to have taken by now have been taken. The remaining steps are well underway and scheduled to be achieved before the opening of the Grange University Hospital. And we look to, if this is okay with you, Chair, just keep board members updated outside of the meeting in terms of progress. Clearly, in our next meeting of the board in November, there will be a comprehensive report on what's been undertaken, the way in which we've managed the risks, and the first few days of the opening of the Grange. So I hope that serves to be a helpful update for board members, and of course happy to take any queries or points of clarification.
Thank you, Carol. That was helpful. Are there any questions for Carol? No, well, thank you. We look forward to being updated as progress is made. So thank you very much. I can see that Stuart Bourne is here. Apologies, Stuart, but you have to leave at 11. So thank you for letting me know about that. Could we then look at the action log? Any comments?
Can I come in if that's okay?
Yes.
Just to say that there is one outstanding action on the action log from the last meeting, yes, in relation to review of the risk register with a specific focus on the workforce related risk. Yes. A paper has gone to Gold Command outlining the work underway to mitigate that risk, and we will bring that forward to the next meeting of the Performance and Resources Committee. And the review of the risk register, along with the COVID-19 risk register, will come forward to the board in November.
All right, thank you very much, Rona. Thank you. So that means we can move to section 2 of the agenda, and starting with the winter protection plan. I think, Carol, would you like to introduce this item, please?
Yes, thanks very much, Chair. So, colleagues, you'll be able to see on your screen now the presentation of the Q3 and 4 operational plan, which also acts as our response to the winter protection plan issued by Welsh Government. This is going to be a trio of presenters, so I'm going to just start us off. I'll then hand over to Hayley Thomas and then to Pete Hopgood. So if we could just see the next slide, it will give an outline really of the requirements that Welsh Government set as part of their own publication in September of the Winter Protection Plan. And the requirements are listed there in a number of bullet points, and it's quite a comprehensive and expansive plan. And whilst this was directed at the NHS, we have taken an approach that is much more in the partnership arena. So I'm delighted to say that we had a joint executive to executive team meeting with the Powys County Council colleagues and also with the Cabinet outlining the key elements of the Winter Protection Plan and with the Regional Partnership Board as well. So we've taken that really a strong partnership approach because we feel that our experience to date has been very much in that partnership vein and has been successful. So the plan covers areas such as prevention and response. So how do we prevent the virus actually getting into places where there are vulnerable people, for example, and how do we respond to a number of outbreaks or incidents as a result. Vaccination programmes, and we may well touch on this in a little bit more detail later on, but the preparation both for the flu vaccination campaign, which is now well underway, and actually COVID vaccination as well. And so we're working very hard to ensure that we've got good plans in place around that. I'll just pick up a couple of others rather than go through every bullet point. So just to say that we learnt an awful lot from the first wave, and we've also during the summer months been able to take the time to ensure that we both learned from the first wave but also got ourselves ready for what is now a resurgence of the virus. So we've got good supplies, for example, of personal protective equipment, and we've got a strong plan around maintaining that. Our work with social care and care homes has been critical as part of the phase 1. And again, we focus on that within this plan. And the real elements of making sure that mental health and well-being and children and young people, we know from some of the evidence that they're the areas that are a particular concern and particular vulnerabilities. And of course, we just touched on in the action log the elements of workforce, but also considering how technology and digital innovation has supported us to work, all of us work in a very different way. So that was the requirements of the plan. The next slide itself just shows that we've broken this really into 8 areas, and this was really the focus of the NHS element of this, and I won't go through those and the cross-cutting areas, and I'll just pull out 2 key areas for me. One is about public communications. I think we will be taking a fresh approach, fresh look at our communications. They've worked very well during the first wave. We got really good feedback from people. But of course, as the pandemic moves forward, we know we need to keep refreshing and finding new ways of communicating both positive messages as well as the things that are the restrictions on society. So that will require some additional work, and we're utilising skills across both the Health Board, the local authority and the Regional Partnership Board in relation to that. And the other element, of course, is the EU transition. We have been focusing quite a lot pre-pandemic on Brexit and now EU transition. And whilst eyes have clearly been on the pandemic, we have had to continue to work on the preparations around transition. So just to flag that to you as well. The next slide gives a sense of the 4 harms. I just want, and Hayley will come on to this shortly, but for those who are less familiar, the government has taken an approach which is about 4 harms. So we know that there is harm from COVID itself. We know that there's harm from not being able to access services because of the ability of the NHS to be able to respond. So that's harm from non-COVID. There's harm from an overwhelmed NHS and social care system, and then there's the harm from the wider societal restrictions and the challenges that we are living under. So I just wanted to highlight that 4 harms approach has been a consistent approach from Q2 onwards, and that will carry us through as well. And then the final slide for me just really is my handover slide to Hayley. And just before I do, I just did want to give a very brief comment on where we are at the moment. We are a day away now from moving into a national lockdown. I think most people have been able to keep up to date with the increasing cases that are happening across the UK, across Wales and in Powys. Our numbers do fluctuate, but we have been at a position where the numbers have been going up. The pressure in the NHS has been going up, and hence the steps that the Welsh Government has taken has been to introduce the fire break. And this will give us an opportunity to ensure that some of that pressure, we hope, is taken off the NHS, ready to help us get through the winter period, and in particular December and into January. So we're also adapting to the changes that are being made by government, and this plan is in that context as well. So I'll just hand over to Hayley at this point. So thank you.
Diolch yn fawr, Carol. Rwyf yn falch I gyflwyno cynllun diogelu'r gaeaf dros Q3 a 4 i'r bwrdd i'w gymeradwyo heddiw. I'm really pleased to present an overview of the board's winter protection plan for Q3 and 4 for approval today. And I'd like to start by thanking colleagues across the organisation for their contribution to this plan, and particularly to the planning team for producing the quarterly plan. This will be the 3rd quarterly plan we've produced this year to meet Welsh Government requirements. In this first slide, this sets out our planning framework for the winter protection period, and it summarises our approach framed by the 4 harms that Carol's just taken us through. We've updated our planning framework for the winter period, and this has guided our approach to how we've been developing robust plans going into the winter period. There's been strong partnership working at both a local level, but also regionally and nationally underpinning our plan. And it also importantly reflects our role as both a provider of services and also as a commissioner. We've had a clinical response model throughout the pandemic response, and this has been updated alongside our support services model, which is really important as these provide the building blocks to support the delivery of our clinical services. Although the main focus of this plan is to articulate our priorities during the next 6 months, we've also got an eye to the longer term strategic priorities that we're taking forward, because we recognise that we may be required to develop an annual plan for 2021-22 soon. The next slide sets out our strategic context, and that sets within our plan our priorities, and includes within this plan a summary, a very summary level, what we've delivered during the first 6 months of responding to the pandemic. It highlights some of the latest available performance information that we have around the impact on service provision, both as a provider and as a commissioner. And also we've updated governance arrangements for the winter period that can flex according to the needs and requirements. We've taken into account a lot of learning during this period, including the insights from the Auditor General's structured assessment, our internal audit findings, and also a really important learning for the future exercise, which was completed, which very much had staff feedback at its heart. So the first part of the plan sets out how we're going to deal with COVID itself, and how we plan to flex our response as demand increases during the winter period. It sets out our actions around how we're going to prevent, mitigate and control COVID, our work on surveillance, and also how we're going to manage clusters, incidents and outbreaks within Powys. We've also set out sampling and testing plan details, and also the important work that the contact tracing team is undertaking. There's a strong focus on high-risk settings and obviously the care homes work, which has been absolutely critical throughout. And we're also approaching, within the detail of the plan, our approach around implementing mass vaccination across the county. The next slide sort of summarises our 5-step approach, and this has been really important because we've had to communicate quite complex messages during this period, and we're building further on this 5-step approach during the winter. It sets out, firstly, the vital role we play as individuals in helping to reduce the spread of COVID, and the very important role of self-care, family and community support. And we've worked very closely with the third sector, and volunteers have worked tirelessly to support people to remain well at home. Powys County Council and other key partners, including the military, have also supported our response within Powys. And the role of primary care is key. We've worked alongside our general practices, community pharmacies, dentists and optometrists to continue to offer access to those critical services during this time. And our community hospitals provide a really important part of the care we provide within Powys. And we have got plans, we've set out within our plans to increase our beds and skills during the winter period as demand increases. And finally, our patients access care around the county, and we've worked with our acute providers in England and Wales to ensure our population needs are included within their plans. The next section sets out the delivery, particularly of essential healthcare, and how we're planning to do that as we go into the Q3 and 4 period. We have focused on actions we can take, particularly against the Big Four, and I just wanted to mention the strong focus on mental health, particularly due to the increasing impact of the pandemic on the population's emotional health and well-being. We've also adapted new ways of working, particularly digital new ways of working, to ensure that we can see as many patients as possible, and this has helped us to prioritise those face-to-face appointments for those in greatest needs. Unfortunately, there is an increasing backlog of patients waiting for care across the entire NHS system, and we are in active discussions with Welsh Government and partners about how we could both recover this position at both the local action level and also more regionally. And we will need to think about how we can work outside of normal working practices and organisational boundaries to deliver the best solutions at pace to meet the increasing backlog of patients waiting for treatment. We have a strong focus in the plan on preparing the unscheduled care system, and there's a separate winter operational plan in the final stages of development, which will be signed off by the Regional Partnership Board and submitted to Welsh Government before the end of this month. And last but not least, I just wanted to mention the significant work that's being undertaken to scale up our flu vaccination programme across Powys, and the plan sets out the detail of that approach. The next slide sets out the work that we're doing around managing the system, and we really recognise the critical role the workforce has and will continue to play in responding to the challenges presented by COVID and the increasing demand caused by winter pressures. Included is our workforce plan and a continued focus on wanting to recruit and deploy further staff. But we've also got a strong focus on staff wellbeing and emotional support and health and training and development. And we're lucky to have in Powys very strong partnership working with our trade unions and staff side partners, which has enabled us to respond at pace in implementing new ways of working. I've mentioned before the digital solutions that we've put in place to support our response to the pandemic, and we've made significant progress in this area and continue to have plans to further embed and implement new ways of working during the next period. And this not only supports patient care, but also the staff to work more effectively. And our communications and engagement has been key to ensure the public is informed of any changes and how to access services. And I think particularly we've been focused on informing the public also on significant service changes that are taking place across our borders. For example, Carol mentioned earlier around the progress that we're making in responding to the earlier opening of the Grange University Hospital. In terms of the impact more generally on wider society, on this next slide, we continue to work alongside our partners and through the Regional Partnership Board and Public Services Board to really understand the impact of the pandemic and to build plans to support recovery in partnership. This will be continuing during winter and for the coming years. And there is a later item on the agenda where we'll be presenting the North Powys Wellbeing Programme. We are still focused, despite the pandemic, on delivering our longer term strategy, but we are taking learning from what we're having to do to respond to this pandemic and recognising that we will also have to find new ways of dealing with the impact of COVID for the longer term. So I'm going to hand over to Pete now, who's going to take us through the finance and capital information within the plan.
Thank you very much, Hayley. So just to run through the key financial assumptions which support our plan. Number one, to remain within the funding envelope as allocated for both revenue and capital. A reminder to the board that at the last board we identified that we would receive funding of 15.5 million as a direct allocation, plus a number of national funded schemes to cover the cost of PPE, TTP, mass vaccination and care homes. Our total forecast expenditure regarding our winter plan and COVID is 26.5 million, and this includes our local authority colleagues' element of TTP costs of circa 4.8 million. We need to note the need, as in every year, to manage our risks and opportunities, and they're included in our overall plan to deliver against our operational and COVID response. The financial plan supports our winter plan, and the delivery of our winter capacity and our surge capacity is detailed, and will require close management and attention to deliver within the funding as allocated. Thank you, Hayley.
Thank you, Pete. Can I ask if there are any questions or comments? We're being asked to approve this plan today. There may possibly be some amendments, but you know, I think the plan, it's a real tribute, I think, I'd like to pay to Hayley and her team and everyone involved, because it is the product of a huge amount of work. I can see that. Are there any questions or comments? Trish Buchan.
Thank you. Hayley, I would like to thank you and your team and the execs for producing this document at this particular time. I think it is really comprehensive and puts us in a good place to manage whatever comes our way. I would like to ask a question, particularly on page 21, the risk heat map. I just wonder, could you clarify the the oxygen supply, is the wording there the right wording? And also, could you explain about the workforce impact and likelihood? I think we've got it as an amber.
Hayley, would you like to come in on that?
Yes, I'm happy to do that. So I'll pick up the oxygen question, and then perhaps Julie Rouse may want to comment on the workforce question. But in terms of the risk heat map, obviously we've been working very hard to get the bulk oxygen storage in place across the 3 hospital sites. We have now got that in place, but we will need to continue to monitor oxygen supply arrangements and how we identify whether we are reaching capacity. So that's the ongoing monitoring of the oxygen supply available at the hospitals. It will only, in terms of the available capacity, we have now increased that capacity due to the works that have been completed. We're near completion with the Newtown Hospital works there. I think it is accurately worded, and I'm expecting the risk to go down once all 3 are fully operational. So you'll see that reduce that risk in terms of the available capacity, but we will still need to continue that there's adequate monitoring of the oxygen supply when all our beds are fully utilised and oxygen is being used on a daily basis. Is that okay, Trish? Did you want to ask anything supplementary around that?
No, that's helpful, thank you.
I'm just wondering, Julie, whether you'd like to comment on the workforce question.
Yeah, Trish, can I just pick up specifically? I know you've referenced the risk score amber that's within the risk register. Is there something specific you want me to cover?
I'm having difficulty getting onto admin control to get it. It's just I think we've got it as a likely risk.
Yes.
A risk that's likely to happen, and we've got the impact as I think a 2, and I'm just wondering if it's likely to happen, is the impact not likely to be greater?
It's likely to happen. We don't know that it's definitely going to happen at this moment in time, Trish. We're obviously looking at contingency plans, ways of covering this off. So in terms of our ability to deliver within the plan, we are anticipating that it's not going to overall impact on our ability to deliver. It's something that we're monitoring very, very closely via both our executive and goal committees, and ensuring that we are looking at all alternatives as they arise.
Okay, thank you.
Thank you. Are there any other questions, please? If not, could we then approve this plan? Everybody happy to approve? I can't see any dissent, so can we take it that this plan has been approved today? Thank you. I can see some yeses there, so I'm very grateful. Thank you. Could we then move on to the next agenda item, the North Powys Wellbeing Programme and the programme business case. Hayley, this is yours again, I think.
Diolch Cadeirydd. Rwyf yn falch o gyflwyno achos busnes raglen Llys Gogledd Powys. I am really pleased to present the programme business case for the North Powys Wellbeing Programme. On the next slide then, our long-term health and care strategy, Healthy Caring Powys, sets out our vision and priorities and identified the need for 3 rural regional centres across Powys. This programme is the flagship programme for the Regional Partnership Board to implement the new integrated model of care in Powys and to do so in Newtown in the north of the county. The Health Board, alongside Powys County Council and Regional Partnership Board partners, approved the integrated model of care presented in this slide earlier this year. In order to enable residents in Powys to live longer, healthier and happier lives, there's a need to shift our focus towards a model of health and care away from service delivery in acute and specialised hospital settings and offering a more integrated model with more well-being, early help, prevention and support delivered closer to people's homes and communities. And we've plans to enable health, social care and other partners to work together to help people live well in their communities, to meet their health and care needs effectively, and to make sure that we can provide as much care within Powys as possible and as safe to do so. The purpose of the programme on the next slide is set out. This is a long-term programme of change, and it's very much in the space of partnership. And the programme business case is one part of the jigsaw in that it sets the case for a collaborative multi-agency wellbeing campus for the population of North Powys. The programme, which was established in 2019, was supported through Welsh Government transformation funding, and I believe it's a once-in-a-generation opportunity for us to bring together partner organisations to enhance and transform the way services are delivered to the local community. I think the programme business case demonstrates that ambition, and in particular it brings together partners across health and social care, but also education, housing, community and the third sector, with further opportunities to lengthen and strengthen our model around leisure, police and the ambulance services. It will also maximise wellbeing and leisure opportunities because there are essential links with green spaces through Open New Town and collaborative working with partners in the third sector and local business, and a strong focus on supporting the economic growth and regeneration of the area in line with the National Development Framework, which identified Newtown as an important regional centre, but it also has very strong links with the town centre supporting Welsh Government sort of initiative called Town Centres First. On the next slide, I just thought I'd explain what a programme business case is. This is a first stage document and is a live document, is continuously updated as further more detailed work is undertaken. And its aim is to set out the strategic direction for the investment and the benefits that that would provide. So it is focused on securing capital investment, which is one of the key enablers to putting in place the full model of care. So this sets out our vision and our case, and we'll be sending this into Welsh Government to support the partnership to take forward the next stage of detailed development for the programme. We've followed the Welsh Government advice to develop the case, and it sets out the benefits of the scheme and also follows what is described as the 5-case model, which sets out the strategic, economic, financial and management arrangements proposed for the programme going forward. On the next slide, we're summarising the benefits that we're planning at a high level for the overarching scheme. And we believe we're presenting a really strong case to Welsh Government because this programme not only supports us to deliver our long-term strategy within Powys, there's also a strong tie-in to Welsh Government policy. Particularly the contribution that we're making across the various areas I've mentioned before, education, housing, health, regeneration. But also we've had a strong focus on the Future Wellbeing and Future Generations Act and about how we can build a sustainable model for care for future generations. And we've used the 5 ways of working enshrined in that act to develop this programme. We've also taken a very strong view around how we should be designing and taking the programme forward, and it's very much based on co-production with key engagement with the public and interested stakeholders. And we have asked people what matters to them so that we're able to build the model on that basis. And that obviously, again, is a key principle enshrined in the Social Services and Wellbeing Act. So although this investment is focused on the capital investment aspect of this proposal for the campus, I just wanted to reassure the board that the overarching North Powys Wellbeing Programme is supporting new ways of working to be implemented and for elements to be tested across the North Powys area. On the next slide, it sets out our emerging model for the multi-agency campus, and the core aim of the programme is to provide significantly improved and enhanced local services delivered from a single location within sustainable and fit-for-purpose accommodation. This approach will maximise efficiency, integration and potential for innovation across the sectors I've mentioned earlier, and I think it's a really exciting opportunity for us to develop a different way of working that fits the rural context in which we're working within. In the case, the next slide sets out, just reminds the board of why we chose North Powys and Newtown as the location for the campus. I think it's important that Newtown is the largest town in Powys, with a population base of over 11,000 people, and obviously North Powys has a larger population of around over 63,000. We know there are high levels of deprivation in relation to both health and economic indicators across pockets of North Powys, and Newtown is a strategically important location in strengthening health and care services for Mid Wales. And I think it's a really excellent opportunity as well to help us do more what we can within Powys to reduce the likely impact of health service changes happening around the borders. The other issue is the current buildings that we work from are of poor conditions and are dispersed. They're not in one location, so there's several buildings in Newtown that we use to provide care. Therefore, there is significant potential for further integration and innovative health and care to be delivered from a single site campus. The next slide sets out the preferred site that has been chosen for this development. It's been very significant technical work undertaken on this, which identified and appraised a range of options around the area, and this was by far the highest scoring option on a number of fronts. I think it's important that the park site, which is right in the town centre of Newtown, it's centrally located, it's near to the car park and transport links, and is a really important location to help ensure that people continue to come into the town centre and support the regeneration of the area. The other issue I'd like to mention is that obviously the park site is a significant parcel of land that is owned by the council, and the council obviously are very key in this development. And on that point, I should tell the board that the Cabinet met earlier this week to consider the programme business case. It went there first, obviously, because of the land ownership issue around the preferred site, the park site. And I'm really pleased to report that I was informed yesterday that the Cabinet has fully supported the content contained within the programme business case, and are very excited to submit this case through the Regional Partnership Board and with ourselves to Welsh Government for their consideration. The next slide sets out sort of an outline plan for the preferred site, and I'd like to, bit of a health warning on this one, it's indicative, there are no definite plans, we still are at the very early stages of this work, and things may move around a little bit. But what this did was demonstrate that the plans that we have for both education, health, social care, housing, community all fit onto the site. And it's really clear also that we've looked at high-level phasing of the plan and what would need to happen where, and particularly the school 21st Century Schools programme. There's been significant work undertaken with the relevant schools and the governors and the board of governors for the schools. The preferred location for the school can be accommodated on the site, as well as making sure that we can deliver what we required for the integrated campus. So this is just an example, just to reassure the board that the site is big enough to accommodate the maximum requirements that we would be looking for when we actually look at the detailed design. The next slide sets out the capital funding requirements for the multi-agency wellbeing campus and our approach to the business case management. So, as I said before, the programme business case outlines our plan to Welsh Government to get their approval for the vision and the range and scale of investment required to deliver the vision for the campus. We'll then deliver and develop a series of business cases for each element. But of course we'll ensure that the infrastructure requirements for the whole site, as well as the benefits of the whole site, are described in each of the cases, and we'll make sure that in so doing we'll have a strong focus on the sustainability and environment requirements as well. So we have considered the various options that we could have taken to develop this next stage of business case development, and we've taken this sort of phased approach because it minimises the risks for the whole campus in doing it this way, but also we've been in active discussions with Welsh Government around the approach, who are supportive around how we've developed the business case plan that sits underneath the programme business case, but also how we're planning to take forward the phasing of the works. Only a couple more slides to go, one more slide to go. I just wanted to give you an indication now of the high-level programme phasing plan. I think, again, I'm reiterating the programme is in the still the early stages of development and design. So we have completed the feasibility, we've delivered an approved model of care, and that was based on detailed population needs assessment and significant engagement, as I've mentioned before. The service design work now will require us to continue to take the next stage of development, detailed design, and that will include the input of our workforce staff, clinical, professional, service user, public and stakeholder involvement. And again, reassuring the board that the detailed design of the facilities and the capital investment will be developed to respond to the requirements of the model and to serve the population of North Powys. So during this next stage of development as well, we'll also have to give equal attention to ensuring that the programme is underpinned by whole system change. So we are needing to test new ways of working and take forward proposals to accelerate our progress towards implementing the integrated model. And there's a very strong focus on workforce, new ways of working and organisational development support as well, in recognising that this partnership will be both innovative and different to how we perhaps work within our individual organisations. So we'll have to work strongly as a partnership on the organisational development agenda. So I'm really pleased to present the programme business today. It's a significant amount of work, and I'd like to thank all partners and particularly the team who've worked tirelessly to turn the vision of an integrated model of care into this programme business case presented today for the multi-agency collaborative campus. And I'm very happy to take any questions.
Thank you, Hayley. Could I ask Carol Shillerbeer to come in and comment then, please?
Yeah, thanks very much, Chair, and thanks to Hayley for that really comprehensive presentation. All I wanted to say really was, when we were developing the health and care strategy, which of course was the first integrated health and care strategy in Wales, we did that back in 2016 and 2017. We involved and heard the views of hundreds of people in our communities across Powys, and so this development is really in response to that. People talked about wanting joined up care. They wanted us to do as much as we could closer to home. They wanted us to focus on health and not just ill health. And so, you know, I hope that this directly speaks to the ambitions that communities had for themselves and for each other. I think this is a once in a generation opportunity for us to do something that is really truly integrated and focused on the well-being of future generations, and this development will really last through decades and beyond. There are some challenges. Clearly, we are now coming to the end of this political term, and the election for the Welsh Parliament will take place in May, as far as we're aware. And it is going to be really key to get this programme business case in front of ministers for sign-off. We know that the First Minister spoke on the floor of the Senedd back earlier this year, or maybe at the end of last year, with support. So we do now hope that that support can be translated into sign-off of our programme business case, because then we can really motor forward on to the next stage. So I'd like to reiterate my own thanks to everyone that's been involved in this work, whether they work for the Health Board, the local authority, whether they're members of the community and our other stakeholder groups. It's been a phenomenal piece of work, and I really do hope that the Welsh Government will feel able to back it and get behind it, and then we can move this forward with pace. So thanks very much, Chair, for enabling me just to say a few comments in that regard.
Thank you, and it is a really encouraging example of collaborative working. It's very, very encouraging. I can see that Melanie Davis would like to come in. Over to you, Mel.
Thank you, Chair. I would just like to congratulate Hayley and the team. I've been part of the scrutiny of the North Wales Programme Board since its inception, and our agreement to take this forward, which is obviously really exciting. My greatest regret is that I'm not going to be here, because my term will have ended by the time we finish this, because it's such a key piece, I think, for Powys. I've always been quite excited by this. But I would just say that our overview and our scrutiny was enhanced the other day. We met on the 19th, and the North Powys Wellbeing Programme Board agreed that we actually needed to widen that base. So just for information for the other members, really, which we haven't touched on, there are now 4 of us on that from the Health Board, and 4 indeed from the board, from the Cabinet, I apologise, in the County Council as well. And that will give us a wider buy-in and understanding as this progresses into this stage now, so that we can have more assurance around that from a whole board position, because it's such a crucial, huge piece of work, isn't it? And so that understanding is critical. So I was just really wanting to draw that in for the board's attention, because it's just such a sort of healthy thing to do, to involve more people at this stage. So thank you.
Thank you, Mel. Susan Newport, you have a question, I believe.
Yes, thank you, Chair. Hayley, my question is, do you envisage the COVID-19 restrictions will affect the future development of this plan long term? I'm thinking here of the difficulties around public consultation, the difficulties we're facing in education and leisure facilities.
Yeah, it's a really important point you've raised, Susan. I think that with all of the developments that we're putting in place at the moment, we've referenced in the programme business case, this one and the next one, we're considering the need to learn from the current pandemic and how we need to respond in relation to that. Thankfully, because we're at that visioning stage with the programme business case, in the next stage of design, we'll be needing to revisit and do further work to understand what that broader impact is, both on education, health, housing, social care. It's interesting because from my perspective, we're building this for the future with very long term in mind. So we do need to make sure it's future-proof from the point of view of responding to the pandemic, but we also need it to be fit for purpose after the pandemic, so that it's can be delivered. But yes, absolutely, part of this work, we've already started to take some learning around ventilation and certain other issues around the physical environment within the current work that we've put in place. But during the next stage, which will take us to the detailed design and the proposals and the space tasks and exactly what goes in where and how we'll be running it. We'll be ensuring that that learning and that impact around the pandemic is considered front and centre, but that detailed work yet hasn't quite happened yet, thankfully, because we've got the time to actually take the learning into this programme of work.
Thank you very much for such a comprehensive answer. Thank you.
Thanks.
Thank you very much. Are there any other questions before we move to approve this? I'm delighted to note that the Cabinet has already fully supported this case. So can I ask you all then if you're willing to approve the draft programme business case ready for submission to Welsh Government at the end of October? Thank you. Thank you very much. I can see that you do approve. Could we then move on to the next agenda item? And this is Llandrindod Wells War Memorial Hospital Phase 2 programme business case. We've already seen some exciting changes there and a lot of excitement on the way with various obstacles, as always, bats in the roof and so on. So, Hayley, would you like to take us through this, please?
Diolch, Cadeirydd. Rwy'n falch iawn I gyflwyno cais busnes y raglen ail cam I gyflwyno ysbyty Llandrindod. Really pleased again to present the programme business case for the final stage, phase 2 of completing works at Llandrindod Wells Hospital. I think that you've already mentioned, Chair, about the work that we've already been doing in Llandrindod Wells, and we've recently invested over £8 million in Llandrindod Wells Hospital site. Obviously, this is one of the sites that's been identified as a regional rural centre, and to expand the range and scale of services available, integrating services to a single location with added clinical space. And that supported the delivery of care closer to home. So some of those examples are we've had better improvements to the dental facilities, X-ray, outpatients, endoscopy, our birthing unit, and also the work on renal dialysis as well in terms of the renal unit. And we're incredibly grateful to Welsh Government for this investment, and we've received really positive feedback despite delays and despite the disruption, that the pain of going through building works in a live hospital site. Despite that, we've had really positive feedback from staff and patients about the improved environment now in which they're working and delivering care, and also our ability, and we've been able to demonstrate that we've extended the use and range of services available on that site. The efficiency and sustainability of the site is also improved. Clearly, we have we're all aware of the ageing estate that we have across Powys, and we have been able to deal with some of the backlog maintenance areas within this initial investment. But it is very important to note when you start refurbishing a part of a hospital, it becomes very clear that you need to finish the site, and it is important that we now set out in this programme business case how we're going to propose a way forward to develop and finish the entire hospital site. And I hope the programme business case sets out clearly what we plan to do to achieve that. So as I said before, on the next slide, the Llandrindod Hospital is one of the regional rural centres, and it's important for us to make sure that we can deliver the right environment and space to deliver care for the local community. For the rest of the hospital, we still have significant backlog maintenance issues on the site, and we do know that we need to make sure that we can develop the service model further to provide the right model moving forward. The case also is important because we'll be dealing and wanting to set out very clearly to Welsh Government how we're supporting decarbonisation. On the next slide, this will look familiar to you because it's similar slide to the North Powys programme business case, in that, just again reiterating, a programme business case is a live document and will continue to be developed as further developments of the work get taken forward. However, this is a very different scale, this investment, to the North Powys Wellbeing Programme. This is at a scale where we're proposing to submit to Welsh Government a programme business case, but for the packages of work to complete the hospital site, we'll then be submitting what is described as a business justification case, which is a one-step process that you submit to Welsh Government and requires you to take it to full tendered costs. And then that way, that approach to the business case can be agreed because the level of expenditure is much less than North Powys Wellbeing Programme, and we're able to utilise the business justification case process within Welsh Government. So this will enable us, by submitting the programme business case, to agree with Welsh Government a programme to submit a series of business justifications cases for the works to complete the site. On the next slide, we set out how we're proposing to do that. So there are 4 key packages. So firstly, the package around works required to complete the front block. The second package being around the remaining part of the hospital. The third package is about dealing with the adjacent properties, and I'm sure the board is reminded of some of the reports that we've had about the environment in which services are delivered within the properties, particularly around mental health services, and we'll be making sure that the adjacent properties are dealt with within this programme as well. And then the final package is around external work. So this is work that will be done to things like heating and infrastructure elements that are outside the hospital site, but are absolutely critical to make sure that it can continue to be sort of operational. So it's about keeping the lights on and making sure that all the infrastructure is fit for purpose. So our plan is, subject to the board's approval, is to submit the programme business case, then to submit the first business justification case early in the year to make sure that we can start this programme of work. And we think it will take probably anything between sort of a few years, not quite sure yet because it's dependent on capital availability of monies, but also about how we manage the detailed design and avoiding the disruption, prolonged disruption on the service for the works to be undertaken. But we were envisaging a series of business justification cases going in over the next few years to complete the site. Finally, just in terms of the services that are being delivered, I think the strategic case for investment is very similar to the discussions presentation I've just given around the North Powys Wellbeing Programme. In particular, Llandrindod has had additional facilities for many years, so we do already have theatres, endoscopy suites and a broader range of services in Llandrindod, so it's about further enhancing that. But in particular, this will help us to deal with the inpatient environment, particularly end-of-life care and facilities for that, the minor injuries unit, physiotherapy, and also that important point around developing an integrated mental health service so that we can support that model going forward. And the next slide sets out some of the, benefits we're expecting to get from this new model of care. We are planning to bring more services back into Powys through our approach around the rural regional centres, and that helps us to deliver better patient care locally in terms of accessibility, but also delivering services in county where it's safe and appropriate to do so enables us also to be able to potentially reduce those commissioning costs in the longer term and have a more sustainable model locally within our community hospital settings. And the final slide then sets out the financial case. Again, for a programme business case, these aren't definite figures. This is an indicative high-level overview of the scale of the investment required to complete the works at the hospital site. And through the work, as we do the 4 business cases, business justification cases, we'll be confirming the costs to absolute certainty of full tendered costs, and those will be coming back to the board. Each of those business justification cases will be coming back through the committee and board structure for approval once the more detailed design has been completed. And the final point, the Llandrindod Hospital reconfiguration works has been led by a project board comprising our staff and also key our lead clinician, John Matson, Dr. John Matson, our GP, and they've been at this for a long time with us, and their contributions have been invaluable and absolutely essential to not only get the first phase of works done, but also to set out and agree the approach for the programme business case to complete the works at the hospital site. And I particularly wanted to highlight the efforts of the Capital and Estates team as well, who have been supporting both of the programme business cases supported today to come through with their technical advice and support. So I'm happy to take any questions.
Thank you, Hayley. I'm delighted that we welcomed the Health Minister from Gethin just before we went into lockdown for a tour of the first phase of improvements, and he did acknowledge how important these small hospitals are to local rural communities. So thank you to everyone involved, and Ian Phillips has a question, or a comment, I should say.
A bit of both, if I may. First of all, I thought it was an excellent document. I particularly like the strategic context. It helped me as somebody that isn't living and breathing the detail of this to understand the context. So that was really helpful and made for a really easy and understandable read. So thanks Hayley for that. I just wanted to comment on it's one of the latter pages, page 85 actually, which is the use of advisors, and just really a comment for the next stage. I note from a digital perspective, we've got the voice and data in there, and just wanted to add to that the requirements really also need to be driven by the clinical information rather than the technology. And you may have that covered with the user, because that may be a clinical user, but just wanted to comment there that I think that's an important consideration as we move forward with this, that we're not driven by the technology itself, but driven by the information requirements of the people and the new ways of working that we hope to be able to achieve in that area. So thank you, Hayley.
Thank you, Ian. That's a very important point. There is a broader piece here, which is around the digital new ways of working and how we support staff and better patient care through these investments. I'm going to reflect on that. I think that in the case we've set out the key areas required in terms of the technical leads, but I think it's a really important point, and we have had the ongoing support of the IT department. But you're absolutely right. From a clinical service user perspective, we have had that. So we've had sign off of the approaches and what we've been doing throughout this programme. But it's a really important point, and we'll review about how we can make sure that is perhaps strengthened. Thank you.
Thanks, Hayley.
Are there any other comments or questions, please? If not, then can I ask the board to approve the Llandrindod Wells War Memorial Hospital programme business case for phase 2 works, with subsequent submission of the business case to Welsh Government? Everyone happy to approve? Thank you. Thank you very much. Really, that brings us to the very last section of the agenda, rather earlier than we'd expected. So is there any other urgent business today? I've had no notification of anything. Okay, thank you. So that means we can close the meeting. Diolch yn fawr, everybody. Next meeting is on the 25th of November at 10 o'clock. Thank you.
Thank you.
Thank you, Chair.